Okay, let's move on. Dr. Cole, reading something interesting about you and your group at Midwest Orthopedics at Rush. Is it true that you guys have probably done more bone cartilage transplants than anyone in the world?
Yeah, I think that's probably safe to say because we live in a state in Illinois where we have an organ procurement organization, which means that every donor that comes from Illinois has to have a return in kind from the tissue processing institution. So it's not easy to get these grafts, but we have a bit of an easier time just because we have tissue banking in Illinois. Not every state actually has formal tissue banking and harvest procedures. So because of access, now we're just a tertiary center where we get patients referred from all over the world, not just knee, but shoulder and other joints, where we actually can provide an alternative to joint replacements using donors who provide bone and cartilage to replace localized damaged tissue.
These are typically performed in the knee?
The knee is absolutely the most common. We have some really unique experience in the shoulder, a little bit in the hip and the foot and ankle, but knee by far and away is the most common.
Now, let's bring on a gentleman who actually works in a sports medicine group in California, a physician's assistant, but also recipient of a osteochondral allograft. And let's get that perspective from both a clinician and patient. He allows us to do that. Josh Hannan joins us now here on Sports Medicine Weekly. Josh, how are you?
Good. I'm doing great here in California. Thanks for having me on.
Fantastic. Hey, what do you tell your patients in regards to expected outcomes? Because you had this done, for your knee?
Yeah, I had it done about a year and a half ago, and my life has kind of come full circle in the sense of what my studies and in physician assistant school, I did a master's thesis on cartilage treatment strategies to prevent osteoarthritis. And about 12 years later, I ended up being an allograft recipient from osteochondral plug. And it's something I definitely recommend for my patients. I'm very familiar with Dr. Cole's research for the last decade in his group, and I was lucky to have a sports specialist in our medical group that I was able to seek out his help for my surgery.
What was the condition that you had treated?
I specifically had a running injury where I sheared off about a nickel-size area of cartilage on the lateral aspect of my knee, and it was very focal, and I thought it was a bucket handle meniscus tear before I had my MRI because my knee locked up on me. But once I got my MRI scanned, I saw there was that chunk of cartilage missing, and luckily I was able to call Dr. Mirzayan in Baldwin Park, and we were able to get me on the donor list and work with some great companies that found a nice match for me, and they put in an osteochondral plug, and I've done great. So
I know you probably work with JRF, who's also the organization that we work with here in Illinois. They're
exactly.
Pretty amazing because they do it's the gift of life, the gift of hope. They provide solutions that we would, years ago we didn't have any ability to help individuals like you, and you just have to kind of progress and smolder along until you're more age appropriate for a replacement. So how was the procedure? It's not common to be on the provider side and then on the recipient side. How was the whole experience for you, and how has it changed your ability to interact with patients, some of whom undergo the same procedure?
Yeah, I have been a proponent of kind of the latest technologies for years. I'm 36. I've been a physician assistant for almost 12 years, and I still remember the days of microfracture. And, I took a hard look at some of the other treatment strategies out there, and I've seen a lot of your PowerPoints through Anna, through the Academy, and all your talks, and I kind of rustled through all those journal articles and talks and finally decided with the allograft technique, and just because the tissue availability that we have now and the good recoveries for an athlete, my goal is, because I was a collegiate athlete, that at some point I'd like to be able to get back to my running days. And so I thought that was best considering the other outcomes for me.
We're talking about bone cartilage transplants. I'm Steve Kashul with Dr. Brian Cole at Sports Medicine Weekly on this Saturday morning. Our guest is Josh Hannan, joining us from California, physician's assistant from the Sports Medicine Group in California, and also a recipient of an osteochondral allograft, getting that perspective from both a clinician and a patient. So what has changed in your technique, rehab, or availability through the years for these grafts, Josh?
Well, I think I would probably I was hoping to see if I can get Dr. Cole's thoughts on that, just because I know it's changed in the tissue availability and some of the, do you soak the graft in PRP or BMAC, some of these biologic treatment strategies.
There's been, and it's unclear, I'm sure there's regional differences, you having your graft placed in California and so forth, and what we do here in Illinois. But, across the country, we're looking at ways to improve outcomes. Statistically, with what you had, which is a cartilage bone transplant, you've got about a 75 to 85% chance of getting back to sports after 8 months with no issues for at least 10 to 12 years. So
wow.
The statistics are really in your favor, even in comparison to any other technique that we currently utilize. As far as things we use to improve the outcomes, we're using biologics like stem cells and PRP, but it's still yet largely unproven. We know certainly that there's no detriment to using some of these things. We just don't know if they're making a big difference in the long run. So and then the final thing is that with donors, the donor pool increasing because of people are signing the backs of their license. They're cognizant of how important it is to be a donor. Where the graft availability has improved. But it could always be better. So that's sort of a soft plea to people out there to consider becoming a living donor, as we say, not only of heart, liver, lungs, but also of musculoskeletal tissue like cartilage. I was curious, what if you could just tell us from your the inside look at, you've been a patient and you've been a provider, just in brief, how has that changed the way you interact with patients? Has it given you a different lens as you try to get inside the head of a patient and looking what they want?
Yeah, it certainly has. I think I did a assist in the case within 6 months of my own allograft surgery. So that was pretty neat and exciting. Especially it was pretty similar in the situation, and I was really able to give insight to the patient. He was a young guy. He was probably 16, and I was able to talk the parents through, step by step in the pre-op area, and able to kind of guide them and give them some extra tips. As far as the recovery, anybody that's active, I really encourage them to take a look at it. And then some of the younger surgeons in my group that aren't too familiar with it and have certain issues, I've had the advantage of touring some of the tissue bank facilities in Ohio and Colorado, and so I'm aware of their, the safety of the tissue, and I think that's really helped some of our surgeons that I work with. They feel more confident in knowing that they can find a good graft, and we can help, these young active patients, so we don't always have to do some of these older techniques. What's great about it, it's a same-day surgery. It can be done in less than 3 hours, and, hopefully get them back to running, depending on, the other injuries and, what their situation is like.
Great stuff, Josh. Appreciate you joining us here on Sports Medicine Weekly.
I appreciate the opportunity. Thanks a lot. All
righty. We've got to take a break. Coming back with our Ask the Doctor segment. Steve Kashul, Dr. Brian Cole at Sports Medicine Weekly, only on
670 The Score.